deficit. Unlike that of men, there is hyperactivity. They get all of them, but just that the percentage way this one they less compared to the other. So attention, and because for the women they always internalize. They don't always talk. To keep them into long G's, they're very difficult. Keep them for long talk, they're difficult. Then fit they imagine in their own world. They feel that they dream. Because one, they feel so they don't feel keep conversation with you for too long. So then they in their own world of their own. And because they internalize things too much, some of them are prone towards creating things in their head. They are prone to depression. Most of them anxiety. If you see most of them say the easy way to cope, say you see that then they feel be tomboys or they try to be bully even amongst their classmates. Because they always internalize the only way to at least find stability amongst themselves is to see that they try to be open to few individuals, oppress certain individuals. But majority of them are much more, their attention is poor, internalize things, much more quiet. In as much as we know ADHD is much more common for people in our boys. But women also follow them, but their own attention problem and dominates more of their problem. So they find it hard to even listen or stay long for one place for conversation and a talk. And then at them they prone to depression, prone to anxiety. Now if you look at even more cases of poisoning where people will take this in, majority are amongst women than men.
Wow.
So this that the kind of people is supposed to go look them proper. They say, what's the problem? Why this gender? According to my people say, this gender. So you will try to check why this gender. So most of them are because of the things really they keep inside. Because of things. So more of their things they are internalized. That's why they are prone to depression, prone to anxiety. Then they don't want to try any new thing. They don't want to stress themselves. They are much more inside and withdrawn. So attention is their number one problem because they internalize that. You will see anxiety setting, depression setting, and when depression not setting, you say what's the attribute of depression? You don't get interest for what you don't used to do anymore. You feel say this life, if you end down, food is supposed to eat, you're not supposed to eat time. You know why eat time again? But you have to say, what's the idea behind life? Then I make you just end your life. So this is the problem. That's why that of women is much more attention deficit and than what men they get like hyperactivity.
As a small picking now, you feel understand the boys' own. But how you go take diagnose the girls' own?
As a matter of fact, that of the girls' own, they difficult.
So how you want take note this picking, this small child, this girl, now she get this thing? Because from the boys you go down the see the way they behave this thing. The girls own you say they did too right. So how you want take differentiate?
Correct. So because as a matter of fact, that of the women, just like we said, they're too open and too obvious like that at all. They're too open. That's why we're talking about giving attention to your picking whenever you see, say, waiting people of in age and in sex fit do at that particular time. You only they skewed a little. If you get picking, see, say, he and persuaded the same pen and do the same class, he mean they get difficulty with assignment and everything. That makes you say parents must always try to check what their children they do for school. If the other person where you did the same class, the same sex, they fit do the brain are the same. That's how you use and interpret now. You understand? That's why I say if you get brain for this head, maybe coconut head, it's supposed they work. So if you know they work, that's where we look. So most of them they are only hidden. So you go try to check why this. You know, we say go don't come the knock the pikin for head to say this pikin no sabi book, you don't know anything and stuff. Look why it happened like that. Maybe to even sit down, listen to the teacher for too long because you know go dey the class as a parent, you know go know. So you have to now make it so long say you get pikin. Now another new job, in as much as they don't give you direct certificate, that one certificate God give you directly. So you don't get any employment. So you have to really concentrate on the children, especially for women. You hardly see it. So whenever I see those achievements, those milestones, as compared to the others, no day clearly. If you see the pikin, they extra withdrawn than others. Look at. I say when people suppose they really play this pikin prefers making day inside house on her own. Try check say why this person do like this. Because while other people are trying to play outside, why are you choosing to be inside? I try when you say they don't even feel maintain conversation, or maybe they try to talk to them, they always raise their voice. Sometimes we'll say, this pikin get temper. Okay, those ones now the subtle hyperactivity they come down because she they try to counter whatever you're trying to tell her. She they find it difficult to even concentrate for too long when you try to even talk. So when you start seeing all those small signs from either school, at home, or work, any of the two say either school or at home, other work at, just speak say there's something wrong with this child. pick that there's something, maybe say the picking dull, maybe that to even maintain concentration to understand what somebody they tell her they had. So if you see the picking they low grade self, concentrate on that picking. If you be saying that because she don't internalize, attention they very poor. That makes so these are the kind of cases. So those are the telltale signs you try to check. After this will keep adding.
All right, ladies and gentlemen, the program na ability inside disability, and the song we will just listen to now from Emmanuel Musa, a person with a visual impairment. Then now the song we will just finish listening to. In the sing say ability day inside disability. If you listen to this song only you go just they get goosebumps. See us for studio, we just the oh my God. God bless you, sir. May una know say for this program, now here you go understand some things. I dey tell una, now here your understanding, your horizon go open. You go there, imagine say all this while where they live. Now for inside world near dey because sometimes if you not see information, you just dey like say you dey hide somewhere. But here go educate you. This program go give you better informate. And as you know, we did together with Mrs. Modupe Afis Ugun, we come did together with Mr. Sam Inyobong, and we did together with Dr. Bako, and then Dr. Yilji Kuntabdong join us.
Thank you very much. I hear one of my people.
Yes, so welcome Bako. And my name still remains Kepsa Laditunji, aka No Space. And before we go for the short break, we come to discuss how this ADHD Attention Deficit Hyperactivity Disorder, how did they affect girls differently from how did they affect boys. And Dr. Bako don't do justice to that one. So we want to move on to the next thing where we want to consider, which is how medication they work for this condition. Now, Dr. you don't join us now, you go just now. The floor is yours. How medication they work for this condition.
To my people, if you remember what we've been telling you last week, see people will get attention hyperactivity disorder. Now, thing where they affect their brain, and they get what they call dopaminergic fibers. They reduce for their brain. So you get drugs we will give them to stimulate the release of dopamine for their brain. It will help them. Make them take stabilize. Now you get people again because then they too hyperactive. Abi, you will fit give them waiting, will fit calm them. Get medication, we go fit calm them. And because again, some of them because they will fit constant, they get other things like depression then. So even antidepressants, they inside the drugs where they give for people who get that kind of condition. So basically now the kind of medication we use, like if we talk of medication in terms of drugs.
This medication,
yes,
it get time duration, or now person go dey drink take am or how did they take give the, because you go prescribe am now. So how long is the person that one day?
Remember, see, you get people where we been talk, say they will feel outgrow am.
Okay.
So if person outgrow am, that person will need drugs.
It means say that person go dey come, make them they do check up on the regular this thing. Oh.
So once doctor don't look them, talk say no, they don't outgrow that one. No, the person will need medication. But if unfortunately that person never outgrow, he will need the medication.
So that the medication now until the level where he don't outgrow.
Yes.
Exactly. Okay. But situation there where person never they outgrow.
Yes. Yeah, you get people who never outgrow. Yes. Where they don't start to take medications right from childhood. Now they are their 30s. Then still they take medication.
Oh my people, now hear this one. Okay, may it not be like say Mrs. Modupe and Mr. Sam just come no vex. Now time. So how do you
now we're at school.
So now, how these medical professionals and educators, now we go start with Mr. Sam. How they fit work together in help these children with this condition. Then Mrs. Modupia will come answer the how the family fit work together together. So wait, I don't they talk now together. All
of them feel
all of them join.
But it was well done. Me, I go try attack this matter from point of view of an educationist and a therapist. So, for instance, if family call me or school call me, say, come, this speaking will not know waiting they happen.